Welcome to Leaders for Health plus Social Good. I'm Vismita Gupta-Smith. On my panel today, we have health ministers from Timor-Leste, Dr. Maria de Ceu Sarmento. I have on my right the health minister of Bhutan, Lyonpo Tandin Wangchuk, sir. And on my left here is Dr. Poonam Khetrapal Singh, WHO's regional director for the Southeast Asia region. And today we're talking about tobacco control. WHO's Southeast Asia region bears a heavy burden of deaths and disease due to tobacco, smoking, as well as smokeless tobacco. In fact, 150 people die every hour in the 11 countries of WHO's Southeast Asia region. And countries have come together and signed the WHO Framework Convention for Tobacco Control globally. We want to talk today about the challenges and loopholes that remain that countries are struggling with, and how are the countries protecting their people against tobacco. I want to start with you, Dr. Poonam Khetrapal Singh. Please tell us, you and WHO and partners have been advocating for tobacco control for a long time. Where are we in the region, and what are our challenges in tobacco control?
As you yourself mentioned, the Framework Convention on Tobacco Control was signed in 2005. So it's really 10 years ago that we signed that member countries really agreed to become a party to the Framework Convention. And we've been regularly monitoring the way it has progressed over the years through the COPs. There are countries in our region which have done extremely well. There are countries in our region which are still lagging behind. And that is not strange, because we are a heterogeneous kind of a region. There is legislation in most countries of our region. I think the challenge is the enforcement of that legislation. Even though we find advertisements and sponsorships on the decline, yet we do know that enforcement of legislation like smoking in public places is still a big challenge. There are smoke-free places that have been declared by all countries in our region, particularly by the two health ministers from the countries that are present here on this particular interview. However, I do find that it is something that all countries struggle with. One important reason for that is that in most countries of our region, tobacco is accepted as a practice. So it's not that people immediately sort of frown upon somebody who's smoking. It's already accepted, and we find that the media, the films, they also sort of flag that, and they fan it, let's say, more and more. Therefore, since it's a practice that is acceptable, the challenge becomes even more. Another reason also is that there are a number of tobacco products in our region. It's not just cigarettes. There's a lot of smokeless tobacco that goes on. There's chewing of tobacco that is very prevalent, and all that adds to the challenge of tobacco control. We find that in this region, there are some countries like Timor-Leste which are now trying to come forth with legislation, and we are hoping very much that that comes through very soon. We find Bhutan, which has already gone ahead with the legislation and perhaps has done a great job in curbing tobacco. They have declared a number, and I'm sure the Honorable Minister will tell us more about it, but they have done a commendable job in trying to control it. Ours is a region which has the greatest number of smokers worldwide. We have 80% of the world's burden of smokeless tobacco, which is huge. And therefore, our attempt really is to see that as we move towards curbing cigarette smoking, we also have to look at smokeless tobacco. As far as cigarette smoking is concerned, we find that high taxation is one way to curb it, which we recommend as a best buy, but that has its own challenges. We find pictorial warnings is a good way of proceeding, and there are countries in our region which are doing a commendable job. We have Thailand, which has almost 85%, both sides pictorial warnings. Nepal also has that, and they both of them have 85%. However, we do find that countries like Nepal, which want to go up to 90%, are facing legislation today. So as countries want to move ahead on tobacco control, the tobacco industry also comes in the way and tries to see that they don't move ahead. So there are cases pending. Thailand has a case which they've recently won, so they'll be able to move ahead with it. But other countries of our region, like India, for example, has 40% only on one side, and they wanted to go up to 85%. That has not been done so far. Nepal wanted to move to 90%. That has not been done so far. So there are these kind of challenges that our countries are facing. Right. We also find that in our successive surveys that we do, and we have the GATS survey, we have the GYTS survey. The GATS survey focuses on adults who are smoking tobacco over 15 years of age, and we have the youth tobacco survey, which is looking at those below 15 years. But the results are not very encouraging, and we do find that our countries are still struggling with tobacco control.
So I want to come back to you, Dr. Khetrapal Singh, and talk a little more about how the tobacco industry is finding loopholes around each of these interventions that you have mentioned, from taxation to public spaces to pictorial warnings. But first I want to come to you, Dr. Sarmento. Timor-Leste has shown high-level political commitment to control tobacco. Could you please tell us about some of the initiatives that your country has recently launched?
Yes. I think, as all know, that Timor-Leste have a high prevalence of the tobacco use in Timor-Leste, almost 70% of the total population. This data we got through our demographic health survey in 2010. But also 2006, 2008, we done one of the adult and youth tobacco survey. It also shows that in the youth tobacco survey, almost 50% of the youth use tobacco. Some of the commitments from our government shows, I think my Prime Minister shows so concern on the tobacco problems in Timor-Leste. He's involved directly on the giving spots on the TV, so a message through the TV spots to our community, and also asking to accelerate the adoptions or approval of our legislation for tobacco control in Timor-Leste. But even we do all some progress or effort to control the tobacco use in Timor-Leste, but still some remain challenges in the Timor-Leste.
I want to talk to you about your challenges, Dr.
Yes.
Sarmento. May I bring in Lyonpo? Bhutan has taken several bold steps to curb tobacco as well. Could you please bring us up to speed on that?
Okay. First of all, kudo zangpo and greetings from Bhutan to all the viewers. History of tobacco control in Bhutan is pretty very long. It started way back in 1990s, and after signing the WHO FCTC and rectification in 2004, sale of tobacco was banned in Bhutan since 2004. Then it followed by legislation in 2010. The Tobacco Control Act was enacted in 2010 and amended twice, once in 2012 and once in 2014. The Tobacco Control Act prohibits number 1 cultivation, number 2 harvesting, number 3 manufacturing, number 4 supply and distribution, number 5 sale of tobacco, number 6 advertisement, number 7 promotion, number 8 sponsorship. And after the act, as per the act, the rules and regulations were being made and implemented. And sale of tobacco banned except for import of limited quantity for personal consumption, and intersectoral collaboration between police, custom and trade departments established for informal system for illegal trading of tobacco, and this is working well as the illegal sale of tobacco had gone down drastically. And we have also included Ministry of Education, since a lot of youths were involved in tobacco misuse. So Ministry of Education is included in the Tobacco Control Board, and promotion and awareness has been initiated in almost all the schools. So in brief, this is what Bhutan has done, and it has worked well, and we hope that we can also improve from here.
I want to open it up to all of you and talk about, as you bring in legislation, what are the challenges you're facing from cultivation right up to sales and promotion of tobacco? And Dr. Poonam Khetrapal Singh, would you like to elaborate on some of the challenges in the region?
Now, we must keep in mind that the Southeast Asia region is the largest producer of tobacco. It is also the largest consumer of tobacco. We face that big challenge. Now, when we are the largest producer of tobacco, there are, of course, a lot of people whose livelihood depends on tobacco growing. And therefore, the agriculture sector also is not very cooperative when we are trying to see how to shift those who are used to tobacco growing to some other crops, so that we could somehow control this menace. Of course, as far as the consumption of tobacco is concerned, all countries have been focusing on it. But India is one country which is really producing a lot of tobacco. And for them, it becomes extremely important to focus on both. There is another important point, I think, which we must keep in mind, that it is not just health and agriculture, other departments also play a role there. And I do recall that Bhutan at one stage had stopped the selling of cigarettes in their shops at the customs at the airports. Normally, when you go to duty-free shops around the world, you do find that there are cigarettes being sold at which are duty-free, and therefore there is a temptation for those who are going through these shops to pick them up. Bhutan had done that, and that was a very commendable measure that Bhutan had taken. And we realized at that time that it became a big issue for Bhutan to dispose of all the confiscated cigarettes, and maybe Your Excellency is going to tell us about it. As far as Timor-Leste is concerned, I realized that when I first came to Timor-Leste several years ago, the amount of people who smoke tobacco, as you have just mentioned, was really high. Even today, when I look at the region, the highest consumption of tobacco and the highest cigarette smoking is found in Myanmar, where about 74% of the males smoke, and closely followed by Timor-Leste. So therefore, this was a huge challenge. I think with the commitment of the Prime Minister, the Health Minister, we now find that there are when I drove from the airport yesterday, I noticed big billboards advocating no tobacco control and no smoking of tobacco. And that, I think, is a very, very major improvement from what was happening here before. So once countries are on board with this, and countries play a very active role in trying to curb tobacco, that is the only way one can move forward. Now, you asked about industry, and industry, of course, will always try to sell. They have an interest in selling. They have an interest in getting our youth addicted at a very early age, so that it becomes harder for them to give it up later. And I do feel even today that perhaps we need to focus more efforts on cessation, because that, just to advocate that people shouldn't smoke is not enough.
Right.
We also have to help them in cessation so that they give up, because one factor which comes through very often in tobacco control is that those who give up smoking have a tendency to go back to it.
Right.
So we have to constantly advocate with them.
Dr. Khetrapal Singh, do you find that we are not doing enough in cessation?
I do think so, and I've been always saying that. We are doing normally we should be doing, but I do feel we need to intensify our efforts, and we need to do far more.
Right, and Timor-Leste is bringing in a very strong legislation. Would you be focusing on cessation?
Yeah, yes. Yes, I think before I go to the how to address this, but it's better to know first about the challenges in Timor-Leste. That one of the most important that we haven't had our approval of the legislations, so a little bit difficult to control tobacco use. But the other point is important is our sociocultures is so accepting the conditions to use the tobacco. For example, in our traditional ceremony, one of the forth to our invitees is to promote the tobacco, to give the tobacco. So everyone should try to take this tobacco. So this is some difficult, and I think with these legislations, we to put in place all the regulation to control the use of tobacco. But for control the social culture, I think we need a little bit more time to change the mental people usually in our culture. So, but all the effort, I think, since our Prime Minister, Minister of Health, all of us work together with the other line ministers to improve like educations, campaign to cessing the use of the tobacco, and we established already we have legislation. We have now our strategies for the preventions of the control tobacco and national authority, and also have national strategy for the non-communicable disease control. So I think all the effort we done with our objectives is to reduce the number of use of tobacco in Timor-Leste.
Right. And you bring out a very important point that tobacco control is not just in the area of health ministries. There are several ministries that have to work together. How is Bhutan dealing with tobacco control and coordination with different departments?
As Timor-Leste has mentioned, in Bhutan, it is otherwise the culture promotes prevention of tobacco, so that is our advantage. So, but in dealing with the ministries and then intersectoral collaboration mechanism is very important. And while implementing the Act, which is enacted in 2010 and the last amendment was in 2014, we have come across a lot of issues and challenges where so many stakeholders are involved, like police is involved, customs are involved. So it is through discussions and cooperations where we need to improve. Then that is one area. Then there are other challenges also as you implement the Act. There are so many challenges which we have come across, and if you may, I would like to also share this with our colleagues here. While the smoke-free zones were identified and demarcated, we still need infrastructure to support that, and we are lagging behind in that. The Act mandates that we have to demarc and provide the infrastructure for smoke-free zone. And one is the intersectoral collaboration mechanism needs to be further strengthened, which I told you in the beginning, and where when so many stakeholders are involved, it is rather very difficult because every agency has their own core mandates, and when some secondary mandates is added on to them, we need some incentives to motivate them to participate, and it's rather very difficult. And human resource for the control of the tobacco is also lagging. The agency called BNCA, Bhutan Narcotic Control Agency, now after the amendment of Act in 2014, it is promoted to authority so that they can have better hold in this intersectoral collaboration.
So they're more empowered to
enforce. They're more empowered with the Act, amendment of Act in 2014, realizing these issues of things. And there also we need to enhance and strengthen the human resource, which has become a challenge. And as Dr. Poonam Khetrapal Singh has mentioned, that cessation program in the hospital are very weak, and in some hospitals non-existent, and needs to be established in where there isn't, and where there is, it needs to be strengthened. And again, the HR, human resource issue is a key factor out there. And we also...
So doctors who are trained and health workers who are trained to identify the need for cessation activities and then administer that. Is that what you mean?
They are multitasking.
Right.
In Bhutan, we have a shortage of medical workers and especially doctors. And for your information, for the whole country, we have only 240 doctors. So they have to do their normal duty. In addition to that, they have to attend to the cessation program also. That's why we need to strengthen and even improve. And we also need to establish a formal mechanism to monitor impact of tobacco control. That is in regard to what Dr. Poonam Khetrapal was saying about the surveys. Because surveys are conducted and the baseline has to be established. Because I feel in Bhutan, it is visible that tobacco consumption has gone down. Since the baseline is weak, the survey says otherwise. So it needs to be, I think the mechanism to monitor needs to be strengthened. And easy access to tobacco products through open and porous border, both from north and south, has become a problem. And that has led to illicit trafficking of tobacco products in Bhutan. Though they are not able to import, they are not allowed to import and sell, but it does happen. So illicit trafficking is also a big issue.
Right.
So these are the main major issues which we are facing, but there are so many minor issues also. And I think by sharing we can always try to improve on these issues.
Thank you, sir. I'm going to let you have the last word, Dr. Khetrapal Singh, as the countries are coming together to discuss tobacco control. Is something that they will also talk about at this regional committee meeting. What is your hope for the region, and what do you see in our future?
Now, since all countries of the region and even globally have accepted that 2010 will be the baseline, until 2025, we are going to reduce the cigarette smoking by 35%. That is the target that we are working on, and I'm very hopeful that in several countries of our region, we will be able to achieve that target. There was an interesting point made about surveys, and I'd like to mention here that we've also got some studies done on the economics of tobacco control, because we feel that is something very important to be used for advocacy with the governments, that there is a whole economic factor, because very often the argument that is put forth in raising taxes is that the governments lose a sizable share of funds when they are going to raise the taxes of tobacco, because smoking will go down. However, this study shows that the benefits in terms of less spending on those who are affected by tobacco, and we know that a large number of people do get affected by it. It leads to deaths also. And I would like to remind our viewers of the 1 million death study, which became so famous and was talked about in our region, that the benefits of that are far more. So that is the way economists put forth this argument,
right.
And WHO Southeast Asia region has been working with the World Bank to produce these studies to show how it can help. And my last word on it would be that even though regulation is important, and we know it is difficult to regulate, however, what is most important and what really works is advocacy with those who do not want to get affected by smoking, because we know second-hand smoking is a very major problem also worldwide. And it's not only those who smoke who get affected. Those who are present while others are smoking also get affected. And I am reminded of a story of a colleague of mine who mentioned it to me several years ago when I visited New York, and I mentioned to him that how is it you're controlling cigarette smoking in the hotels of restaurants rather of New York, when we find it a big challenge in our region. And he said to me something very interesting, which is that he got together all the waiters and briefed them on the harmful effects of tobacco smoking, and he was particularly referring to second-hand smoking. And he says the waiters then stopped serving those people who was smoking and said that we will not serve you because we don't want to get affected by it. And that was one way in which he could bring about a change. So there are many innovative ways which we could think of how to proceed on tobacco control.
Thank you very much. There you have it. If you're a non-smoker and someone smoking next to you or around you, stand up, make a big fuss and don't put up with it, and help our leaders in health to help protect you from tobacco.